The amount of twin mums that have experienced heavy bleeding for a large proportion of their pregnancy is staggering. It's so common. Hi, I'm Jem and I am a twin mama. Today I'm going to be doing the next episode of my 250 pregnancy niggles. In particular, I'm going to be talking to you from the perspective of having a twin pregnancy, but this is applicable to all pregnancies. Today we're talking about spotting and bleeding, and if you are having multiples, this is a really important thing to know. Spotting usually in pregnancy can be very normal and very light. If you spot, you're normally told to look out for things like the colour. So if it's pinkish, that normally means everything's totally fine. And you're also told, like, as long as it's very light, you should be fine. But obviously with all spotting, you do need to tell your doctor, your midwife, whoever is looking after you during your pregnancy, just so that they can make a note and advise you if they think it's okay or if there needs to be a bit of investigation. For us, we actually spotted the day after I got pregnant, and that was kind of scary. It was kind of reddish, kind of pinkish, and we panicked because I am polycystic. My mum was polycystic. My mum had a terrible experience trying to get pregnant with my sister. That went on for almost 15 years. And for that reason, we were nervous. We knew that my mum had experienced miscarriage, many miscarriages, more than you know I would know how to bear myself, and we were frightened by the fact that I had spotted. What we didn't know was that over the course of the pregnancy I would go on to have 5 whole weeks of not just spotting but bleeding. This happened around the 12-week mark. We had had our first scan by that point, and we knew we were having twins, and we knew that they looked really good and that they were moving and kicking and being, you know, crazy little beasts already. But that doesn't change the fact that you literally want to die when you see blood. And there was a significant amount of blood for me to just lose my mind. We were, we phoned up the Medicom service, which here in the UK is a 24-hour service for phoning up about any pregnancy worries that you have. They booked us straight in for an emergency scan the following morning, and that was incredibly terrifying, getting down to the hospital the next morning and sitting in a waiting room knowing that you're sitting with other women who are going through exactly the same turmoil right now. This is the emergency scan department. There's nobody sitting there, expecting good news. Everyone is fearing the worst. And we were fine when we had that scan, luckily. But we went on to have another 5 emergency scans, and it went on for 5 whole weeks. And there's nothing about that online. There's no pregnancy manual that will guide you through that, and there's no GP or no twin doctor, no general pregnancy obstetric doctor that will guide you through that, because there isn't much known at all. When they scan you, when you're having bleeding during pregnancy, they're looking for things like a region of your womb where the bleeding seems to have stemmed from. They're looking for sort of an area of hemorrhage. They want that kind of dark spot on the scan that they can sort of see and go, There's the problem right there. They also want to look for things like a kind of pooling of blood in the images, and there was nothing of any description on our scans. There was just two tiny little babies having a thoroughly good swim around, and all I really had to kind of explain the heavy bleeding I was experiencing was the fact that I was already growing at a tremendous rate. I already looked at least 6 months pregnant, and it was my first pregnancy ever. And I was in a lot of pain, not just things like, pelvic girdle pain and just general aches and pains all around my body, but I had specific stomach pain all the time. My skin of my stomach hair, I had period pain all the time. I had shooting and stabbing pains in my womb. And the only thing that I could suggest to my doctors, to my sonographers, was, do you think I am bleeding because my womb is literally growing so fast that it is tearing slightly, the way fragile skin would tear if it was stretching at a rate it's not capable of? And they were like, yeah, I guess that could be it. And that's all I know. That's all I know. I had 5 weeks of that, and I'm still none the wiser. And there's no pregnant or no twin mum that I know that has a definitive answer. But I do know, having spoken to a lot of twin mums and having searched on so many pregnancy forums, that the amount of twin mums that have experienced heavy bleeding for a large proportion of their pregnancy is staggering. It's so common. So if you're pregnant, whether it's one or more, and you have bleeding, I want you to know, please don't panic. You need to be seen. You need to tell them everything you know about the situation, all the other symptoms that you have going alongside it, answer all their questions, but try not to panic, because amazingly, I mean, who would think that you can have a pregnancy that is 100% healthy at the end? My babies came out perfect, but for 5 weeks of that pregnancy, I bled so heavily. You wouldn't think that that's possible, but the human body is an incredible thing. The womb is an incredible thing, and it is designed to shield your baby from any turmoil that your pregnant body is going through. There's not much that your womb can't protect your baby from. And if you're having a bleed, don't overthink it until the doctors have a good look, scan you, and tell you what's what. Because the chances are you could do more harm than good just by panicking, just by freaking out. Don't get stressed. Don't let those horrible stress chemicals into your body. That's probably going to do more harm to your baby than what is currently going on. So just try and, breathe through it until you get that sort of sit down moment to have the scan and see if everything's okay. If you don't have a bleed, if you're just having spotting, panic even less. Try and remember that it can be a normal indicator of early pregnancy. Some women don't actually have spotting until around 10 weeks of pregnancy. So it can happen, quite late. And also, as women get more established in their pregnancy, in the 3rd trimester, you can also experience a bit of spotting as your mucus plug for the cervix starts to prepare for birth. So there are many reasons, not all of them are scary, why you can have spotting and bleeding. So hopefully, if you have experienced that, or you're worried about that may be happening, or you kind of don't know if that's happened already, tell your doctor, keep calm, and amazingly it can all be fine. So don't stress. And I'm living proof that you can have pretty horrendous bleeding for a good chunk of your pregnancy and still be fine. So if you're having this particular symptom, do seek out medical help and do keep calm. My name is Jem. I hope you'll stick around for the rest of my 250 pregnancy niggles.